Hello, Matthew Holmes here from iconpractice Clinic Management Software. This is the second video that we're releasing from our archive where we're talking about how you can actually use technology, in particular email sequences, to improve compliance to your care recommendations and so forth, and so help your patients get optimal results from your care, but at the same time help your business get optimal results from the new patients that come into your practice. So hopefully you'll find it useful. Keep an eye out for the following videos. We've still got another 2 videos to be released in this sequence, but I'm sure you'll find this one to be of use. Hi, Matthew Holmes here from Clear Health Media. Welcome back to the series where we're talking about how to optimize the sales funnels and the processes and so on within your practice to maximize the business returns that you can get and also the patient outcomes that you can get within your practice. In the last video, we talked about the marketing funnels that you might want to actually set up in order to start getting leads coming into your practice, so potential patients. In this video, what I want to do is I want to talk about the actual in-office things that you should really be doing in order to maximize your patient retention so that people stick around and follow your recommendations and actually get the maximum results that they can possibly get within your practice, and also therefore the practice getting the best business outcome that it possibly can as well. So what actually happens? So let's say somebody comes into your practice as a new patient, and let's sort of map out a patient journey through the practice. So they come in and they fill out your new patient paperwork, they have the initial consultation with yourself. You may do some sort of report of findings. I certainly hope you will be doing some sort of report of findings where you actually sit down with the patient, you explain to them exactly what is going on, how long it's going to take to fix, the steps that will be involved with that, etc. A real educational process where you're mapping out the journey that the person needs to be doing, and then you're obviously asking for consent at the end of that process and getting them to sign documentation, etc. for that consent, so that they're very educated before they actually start the treatment process. Now, you may do that on the first visit, you may do it on the second visit. It depends on what your particular procedures are within your clinic. There's pros and cons for both, but we've got a report of findings here in the first or second visit. Now, what then happens is the patient obviously goes home, and one other thing is I would be encouraging you to get spouses and partners, etc., in with the patient when they're actually going through the report of findings, so that the partner's on board as well as the patient themselves, because obviously if the patient goes home and talks to the partner and the partner says that, no, can't afford that or whatever, then that's going to be a major roadblock to them actually complying with your treatment recommendations. But regardless, they go home, they sort of start to get back into normal day-to-day life, and you've got to remember that it can actually be very easy for people to forget what you actually said to them. So what I would recommend that you do is that you set up educational procedures within your practice to maximize the retention of the information and to make sure that people actually understand the steps that they're going through and so on and so forth. Now, what you might do as part of that is that you might want to do some sort of email sequence. So you might set up an autoresponder, which when the patient comes in on their first visit, you put them onto that email autoresponder. First email is, thank you very much for choosing our practice. Really great to have you here, etc., etc. Second email comes out a couple of days later. That talks about things like what they can do to improve their results from the treatment, etc., etc. Third email comes out 3 or 4 days later after that, starts talking about things like the types of conditions that you might see in your practice, so things that they could refer to you for. So if you are a chiropractor or a physio or whatever, you might sort of talk about how they've come in for back pain, but you can actually help neck pain, you can help sciatica, you can help knee pain, you can help shoulder pain, you can help all sorts of different things in addition to the actual presenting complaint that they've come in for, and you would be really grateful if they would refer other people in as well. And then you basically then continue to follow that up with a series of emails that talks about the different stages of care that they're going through. And what you can do is you can drip feed those into the stages of care, because obviously somebody will tend to come in, they'll usually be in some sort of acute type of pain. And then what's going to happen is they're going to move into a rehabilitative phase of care where they've got out of pain and they've lost that motivator, which is the main thing which initially brought them into the practice, i.e. pain. And so what you have to be ready for is the fact that they are losing the original motivator which brought them into the practice in the first place. So when they switch from acute to rehab, you need to be there to reinforce the need for further care. And that might be things like they actually sit down with you and they do a re-examination and you go back over the goals that you're talking about. You could be handing them leaflets about rehabilitative care and the importance of sticking with the program even beyond the fact that the pain's gone away. You could be timing your emails so that the point where most people actually get to that point is when the email autoresponder starts to send out emails at that particular time, etc. So there's a number of ways that you can go about that, but you need to be primed and ready for that, because otherwise what's going to happen is they're going to get home, they're going to say, I'm feeling fine. They've forgotten everything that you talked about in the first visit, and so as a consequence they drop out of care. They've got a suboptimal clinical outcome. Your practice has got a suboptimal business outcome, and that's not really good for either of you. And then what's going to happen is they're going to reach a point where they're potentially as rehabbed as they possibly can be. For some people that might be 6 months, for some people that might be 6 weeks, for some people that might be 6 years, you never know, okay? It's going to vary according to the patient. But what you're probably then going to want to do is you're going to want to consider things like wellness care. Now, there is quite often a lot of resistance to that, but it doesn't have to be intensive type of thing. What you might be doing is you might sort of want to suggest to them the idea that they might want to come in for a regular massage with your therapist, your massage therapist that you've got in the office. You might want to put them in for a Pilates class that is run once a week or once a month or something like that. There's all sorts of ways that you can actually be sort of putting people into a wellness type of program which is beneficial to them and to your practice without doing things like over-servicing, etc. We're not necessarily talking about anything like that. We're just talking about some sort of regime, and it can be, you know, a pamper type of thing where they may not actually even think that their massage is necessarily helping them a great deal, even though we know better that it would be. But from their point of view, it's more of a relaxation type of thing, etc. Okay, so that's what we can do here. So you've got to remember that you are always going to be needing to prepare people for the next stage in their care before they get to the next stage of their care. Otherwise, they're going to drop out of care. There's also a whole stack of things that you need to be doing around sort of training with your team. I would be really encouraging you to make sure that this whole process is systematized. So you need systems within your practice where, on visit X, then, Mrs. Blog gets X leaflet, and on visit Y, then she gets X leaflet. If the patient rings up to cancel, your reception staff need a script to enable them to actually answer that question before the person gets off the call, to make sure that the person knows that the doctor will follow up with them so that they don't drop through the cracks of care. Your practice management software needs to be something which is going to enable you to do easy follow-ups with cancellations and DNAs and people who don't rebook subsequent visits, etc. There's a whole stack of systems that need to be set up within your practice to stop you leaking patients out of this funnel and therefore leaking revenue out of your funnel. So what we've covered here is a whole stack of systems that you need to potentially be getting set up within your office. What we're going to do in the next video is we're going to sort of be talking about your fail and discharge type of procedures, which to some degree sort of slot into this, but I really wanted to emphasize the aspect of making sure that you're prepared for people as they're moving through the different stages of care in this particular video. If you need assistance with getting any of these education sequences and so on set up in your practice, by all means give us a call, but otherwise I look forward to seeing you on the next video.